Good morning. My name is Giri Babu. Today I would like to explain diabetes mellitus and their symptoms. This is one of my interactive teaching session video. In this video, I try to explain what are the types of different diabetes mellitus and their features. Before moving to our real topic, we need to know about pancreas. So the pancreas basically has a two parts. One is exocrine part and other one is endocrine pancreas. Exocrine pancreas will be releasing the enzymes. Endocrine pancreas will be releasing the hormones. So endocrine pancreas have a islets of Langerhans. These islets of Langerhans composed by the four type of cells: alpha cells, beta cells, gamma cells, and PP cells. So alpha cells will be secreting the glucagon, beta cells will be secreting the insulin, and D cells or gamma cells will be secreting the like somatostatin, and PP cells will be secreting the pancreatic polypeptide. So if there is a pancreatic beta cells will be destruction or maybe damage, it will be lead to the diabetes mellitus. Today we will focus on the diabetes mellitus. What is the diabetes mellitus? Basically, diabetes mellitus is a metabolic disorder due to the insulin deficiency, blood glucose levels be increasing. Basically, it is two types, type 1 diabetes and type 2 diabetes. Type 1 diabetes also called like insulin dependent diabetes mellitus. Also we call like a juvenile diabetes. So why we call like insulin dependent diabetes mellitus? Because in this case insulin deficiency will occur. Reason, autoimmune attack on the pancreatic beta cells so that the pancreatic beta cells destruction was occur. Once 80% is like destruction was occur, then only we notice symptoms. Especially we can see this type of diabetes mellitus on the children's. We call juvenile diabetes. The treatment is mainly insulin only. Next one is type 2 diabetes mellitus. It is also called like non-insulin dependent diabetes mellitus because here insulin is there but insulin resistance was increased. Nearly 90% of diabetes patients are type 2 diabetes mellitus. We can see at the late age due to the sedentary lifestyle factors and also sometimes genetical factors also, sometimes environmental factors and stress also will lead to the type 2 diabetes. Type 2 diabetes, because here there is no requirement of insulin because they already have a insulin, they have a insulin resistance only. Why the insulin resistance was occur? Mainly obesity, it will causing like insulin resistance and also adipokines increasing in our blood, especially leptin, adiponectin and resistin and TNF alpha. It will be lead to the insulin resistance. What are the symptoms of diabetes mellitus? So you know that frequent urination, thirst, unexpected weight loss. Sometimes we can see gastric problems, sudden vision loss, and feeling tired, and extreme hunger, and also very dry skin. Also, we notice. So, before going to the symptoms, we need to understand if the insulin deficiency will occur, what happened in our body. It affects on the carbohydrate metabolism and protein metabolism and fat metabolism also. So, especially once insulin deficiency will occur, it will be increasing the blood glucose levels and glycogen breakdown also and decreasing the peripheral uptake of the glucose. So, as mainly the protein breakdown will be increasing and decreasing the protein synthesis and also catabolism of amino acids also increasing. So, gluconeogenesis is also increasing. Coming to the fat metabolism, it will be increasing the triglycerides breakdown so that circulating free fatty acids will be increasing. It will be lead to the ketosis, resulting ketoacidosis will occur. and also decreasing the fatty acid and triglyceride synthesis. Now we move to the features. So hyperglycemia will occur. Why hyperglycemia will occur? Because once glucose cannot enter into the cell, so that the glucose accumulation on the blood, so we can see hyperglycemia. And also other feature is polyphagia or increasing the food intake. So you know that in the hypothalamus, ventromedial hypothalamus, VMH center is there. That is also called like a satiety center. It was normally inhibit the lateral hypothalamus and the lateral also called like a LH. This is the feeding center. But VMH mostly depend upon the insulin for the glucose uptake and utilization. Once the insulin deficiency will occur, so it will what will happen? Decreasing the activity on VMH. So VMH remove the inhibition on the LH. So LH means lateral hypothalamus is a feeding center, so that the LH activity will be increasing. So the patient like to eat more food. This condition we call like a polyphagia. Next one is polydipsia, increasing the fluid intake. You know that diabetes patient we can see polyuria, so the dehydration will occur, excessive weight water loss will occur, so it will be lead to the stimulate the thirst center. So the patient like to drink more water. Glucosuria, next condition is, you know that excessive glucose in the blood, very difficult to filter. So the glucose also we can see on the urine. This condition called like a glucosuria. Mainly when the glucose levels will be reaching above 180 mg per deciliter. So we call like a renal threshold. This will be lead to the glucosuria. Next feature is polyuria. Why the polyuria will occur? You know that failure of reabsorption of the glucose at the proximal tubule, and also prevent of normal water and electrolyte reabsorption also. So it will be disturbing the osmotic diuresis. So sorry, it will be causing the osmotic diuresis, so that the polyuria will occur. Finally, weight loss. You know that once the glucose utilization was not occur, it will be lead to the fat and protein breakdown, so that muscle wasting was occur, so it will be lead to the weight loss. So main other symptoms also there, ketosis and acidosis. You know that once the fat breakdown will occur, especially on the type 1 diabetes mellitus, the ketone bodies will be formed. These ketone bodies will be increasing in the blood. So this condition we call like a ketonuria. Once the ketone bodies present on the urine, that condition we call like a ketonuria. Acidosis. This ketone bodies present on the blood because the ketone bodies are acidic nature. So this condition we call like acidosis. So especially we can see on the type 1 diabetes patients, this acidosis will be stimulating the Kussmaul breathing. So the rate of and breathing will be increasing. So the breathing will be lead to the decreasing the CO2 in the blood. So it will be lead these symptoms we call like a diabetic ketoacidosis. So especially this is very emergency condition. So we need to replacement of insulins and also fluid replacement. Now we move to the interactive session. So what is the first question is, which of the following is the classic symptom of diabetes mellitus? Next one is, polyphagia in the diabetes mellitus referred to. The third question is, ketosis in diabetes mellitus is caused by. Come to the first question, which of the following is the classical symptoms of diabetes mellitus? What is that one? Polydipsia, hypertension, bradycardia, and hypothermia. So answer is polydipsia. Next one is polyphagia in the diabetes mellitus is referred to increasing the thirst, increasing the hunger, increase the urination, increase the sleepiness. Answer is increase hunger. B. Next one is ketosis in the diabetes mellitus is caused by answer. What is the answer? So lack of insulin leading to fat metabolism. Thank you for watching this video.